Welcome to Apollo Fertility Borivali. This is our state-of-art fertility unit dedicated to infertility treatments only. We have all the advanced facilities related to fertility is available here. Today I am going to give you a little tour of our this center. This is our Apollo pharmacy. All the drugs which are related to fertility is available in the pharmacy, so you don't have to go outside for any single medication. This is our reception area. In this reception area, whenever you come to the hospital, first you need to do a small registration process, and all the documents like Aadhaar card and everything, we usually keep a copy. And this small temple dedicated to Sai Baba. We also have in-house small dental clinic in fertility. Then this is our reception area, which is thoughtfully designed so that patients should feel comfortable while waiting for their turn for consultation. And this wall is dedicated to Dr. Reddy, who is the architect of Apollo Fertility, or the whole Apollo itself. Then we have small admin room for a manager of Apollo Fertility. We have 3 consultations here, 1, 2 and 3. This is for doctor consultation room. Then this is a wall where patient can give their feedback. On the Google also we have nice feedback from patients. This is small scan room where we do all the ultrasound related to infertility, related to IVF procedures, IUI procedures. I will take you up to the laboratory also. Please come with me. So this space is dedicated to operation theatre and laboratory. We also have one private room here. And let me take you to the OT unit and laboratory unit. You will have to remove your shoes here first. You will have to wear chappals in order to maintain the sterilization. You will also need. And now this is a ward. This ward is having a capacity to accommodate 6 to 7 patients. Every bed is separated by proper curtains and the wall. Then there is a nursing station here, where usually nurses sit. There is a patient changing room, where before actually going to OT or the laboratory, patient need to change. Even we also need to change before going inside the OT. This is OT area and laboratory area. As of now, we cannot go inside because we have not changed. So maybe some other day we'll go inside. But here, all the embryos and everything is made here only, right? And also we have a special dedicated operation theatre for doing a endoscopic surgery like hysteroscopy, laparoscopy here. We have a room for cryopreservation, that is freezing the embryos here too. Good afternoon everyone. I am Dr. Ankush Raut. I am a fertility consultant at Apollo Fertility Borivali. Today we will discuss about fertility as well as Apollo Fertility. So whenever we plan for a pregnancy, and if you fail to conceive even after 1 year of continuously trying for a pregnancy, then that condition is called as infertility. Although we all know that baby is very important, but it is also very important to have a pregnancy within very specific time. For nature, 20 to 30 is called as the best stage of having pregnancy, because in 20 to 30 both male and the female is having adequate reserve for their sperm as well as for their eggs. Especially in female, after 30 number of eggs goes on decreasing, and after 35 the decline in the rate of eggs gets almost double, and after 40 their chances of having a pregnancy decreases drastically, and chances of having abnormal pregnancy also increases as compared to when they are young. So it is very important to plan a pregnancy when you are in between 20 to 35. And suppose if you are in between 20 to 35 and still if you are not able to conceive, even after continuously trying for 1 year, it means that this is the time you should visit the fertility center. At Apollo Fertility Borivali, we try to give you the best possible services related to fertility, as well as we also have a fertility score system where we tell you how many more years you can try for pregnancy naturally, or you can postpone your pregnancy, because there are many cases. Suppose if you may plan to have a pregnancy after 2 to 3 years because of the profession, or maybe you are having some disease like cancer. In those cases, whenever you want to postpone the pregnancy, it is better to do a fertility score where you will come to know how many more years you can actually wait for pregnancy to happen. In Apollo Fertility, we have facilities of doing like IVF, ICSI, laser assisted hatching, blastocyst culture, all the advanced facilities which is needed to you in order to plan your pregnancy is available in Apollo. Thank you. Please come. So I am going to take you to the OT and laboratory complex. This is our OT and laboratory complex. This is our embryology lab, and she is Shraddha. She is the chief embryologist here, and she will tell you about the laboratory.
So this is the micromanipulator, RI micromanipulator with attached laser. This is our laminar airflow hood. Then comes the box incubator, which is HERA cell, and benchtop incubator K system.
And it is a place where actually embryo is made, and it is made by Shraddha. She is the chief embryologist here. She is trained with pre-implantation genetic testing for aneuploidies, pre-implantation genetic testing for monosomies. She can do the laser assisted hatching. So she can do all the advanced fertility related work in this small laboratory. Although these are all equipment, but these are very advanced equipment related to infertility. Please. This laboratory is having inbuilt HEPA filter system, as well as the CODA filter, which remove all the reactive oxygen species which sometimes can and the VOCs also, which can sometimes harm the embryo development. So all the things which are important for development of embryo is taken care in this laboratory. This is IVF OT, where the embryo transfer is usually done, and this OT is connected with the laboratory directly, so as to prevent the exposure of embryo to the environment. It is kept adjacent to laboratory. And these are the small nitrogen filled tanks, and in these tanks embryo is frozen. This is the advanced endoscopy unit, and this is the OT where we do laparoscopy and histoscopies for all the patients.